All right, welcome into another episode of For Your Health, the podcast presented by Roane General Hospital. I'm your host, Andrew Miller, as per usual, and I've got a very special guest today to talk about a very, very important topic with regards to the Prescription for Your Health program. We talk about all ages on this podcast. We talk about all types of exercise, but when we specifically focus on an aging population and how we want to give them the best quality of life, osteoporosis is a very, very important topic to discuss with people who are trying to stay active, trying to become active at a later age, all sorts of things happening. So we're very happy to be joined by Laura Smith, who is a certified physician assistant. Thank you very much for joining us, number one.
Hello.
Appreciate you being here. And you're going to kind of run me through, because I honestly don't think, I know what osteoporosis is, as far as a basic definition. That's all I really know about it. I haven't studied it. I don't think about it much. But this is a very, very important part of living a high-quality life when osteoporosis comes into or starts. We're going to talk about, number one, what it is, some of the things you can do to help stave it off, what happens when you have it, all sorts of stuff. But first, we always got to talk about your histories, right? I want to talk about why you got into this field. Why are you a certified physician assistant? Where did it start for you? Did you always think you were interested in the medical field? Was it something that happened that you were like, oh, I think this is for me? We always are interested in our guests telling us their history a little bit. I don't want you to tell me the entire history. That's fine. But where did you get involved with this?
So at a young age, I had a family member. She was born with osteogenesis imperfecta. She was my first cousin, and she passed away at the age of 18 months. During her lifespan, she lived with my parents and I at our home until she passed away. And so to see the doctors interact with her, the nurses interact with her, to see how that they were able to take away her pain, help her, calm her, and just the in general care for her led me to decide that I wanted to be in medicine. I initially thought I wanted to be in peds, but going through rotations and stuff like that, I found that my heart was more with general practitioner. So to take care of everybody instead of just pediatrics.
So let's get into it. Since I didn't give you a lot of time here today, let's talk about basic bone health. And I mentioned the aging population, but this doesn't, I guess, necessarily have to be just with an aging population. I just think of osteoporosis as one of those types of things. Let's talk about the basics of bone health first before you start seeing these things that happen. What are some good ideas for this?
So for bone health, it's in general, it starts basically in our young youth and working up until we're adults and then also into our geriatric population. So things that we can ensure to have good bone health is to make sure we maintain a good, healthy body weight, that we're always physically active, getting at least 30 to 45 minutes of exercise 3 to 4 times a week. And that's basically weight bearing. So when you're weight bearing exercises, you're stimulating the bone to make, to grow, to make its cells to grow and to make heavier bones. So that's important. Abstaining from any alcohol, abstaining from smoking, making sure that you have a good calcium regimen in your diet, 1,200 milligrams daily, whether that's through a supplement or if it's through food. It's better absorbed if you eat the calcium in your diet versus taking a supplement. Unfortunately, in West Virginia, we're noted to have a lot of vitamin D deficiency. So checking and making sure that's good. So because calcium and vitamin D go hand in hand. So those are some of the things to keep in mind. But also if you have we have a lot of chronic medical conditions that can lead to osteoporosis. People that are undergoing cancer treatments, those that had transplants, or even chronic medical conditions such as a autoimmune disorder.
Yeah.
Those things can lead to the point that you would need to be treated or be evaluated for osteoporosis.
So I think about that when you say eat pretty healthy, exercise, do the basic things that you're supposed to do.
Yeah.
It's amazing what basic things people are supposed to do that people don't do. So
Yeah.
Obviously, those are some of the great ways that you can stave off these problems with bone density. But obviously, it happens. And so let's talk about osteoporosis and how you can manage it if you do get it.
So osteoporosis is managed in a few ways. So our first way to find out is like if you've have osteoporosis, we screen you through a test called a DEXA scan, which is a low-density X-ray to check and see what your score is. We go by this; it's called the T-score. Anything greater than 2.5, you're automatically listed as osteoporosis. But you may be considered osteoporotic even if your DEXA scan score is less than negative 2.5. So if you're at 2.4 back to 0, depending if you've had what we call a fragility fracture, which is a fall at ground level, and you fracture, like, say, your femur or your hip, or you fracture, your ulna or your radius or your humerus, those are considered, you need to be treated if you're still in the osteopenic status. Because your bones because you should not fracture at a ground level fall. Okay. So we go through that. And then, so once we establish that you need to be treated, there's different medications that can treat it. There's oral medications, there's injections, and there's also infusions. Okay. Depending on what your, labs show, whether you have good kidney function, your calcium levels, and things of that nature, your other chronic medical conditions, is to decide what course of treatment we would use for you.
So I think about that. How do people often figure out that they have osteoporosis? Is it because of falls, or is it because of fractures?
Technically, most time, yes, it's because they have fractured. So by this point, we're playing catch up. Unfortunately, screening does not start until the age of 65 for women and over 70 for men, okay? Unless you have a good practitioner that notices that you have a chronic medical condition that predisposes you to have early onset osteoporosis.
Yeah.
Women are extremely at risk for this because when they go through menopause, they don't have estrogens, which helps protect the bone. So, once we don't have that bone protecting ability anymore, we're going to develop it at some point, basically. It's just when.
So the question with that is obviously you talked about there's ways that you can stave it off. There's ways that you can, weight-bearing exercises, eating well, getting your vitamin D and your calcium in your diet. If, for instance, if you say women who may be getting close to that stage of menopause, or women who are going through it, is there any extra things that they can do to try to mitigate that issue at all?
So being active definitely is the biggest thing. It helps your body reproduce your bone, where you're as we get over the age of, we build bone till the age of 30. After 30, we start, at 35, we start losing bone mass to some degree. So basically, we're not turning over and making more bone than the, what we call the cells that chew up the bone and clean it out. So they're chewing up more bone, and we're not producing it as fast as it's cleaning it out. So, that's one thing we can definitely do, is weight-bearing exercises. Beforehand, if you're going through the perimenopause state, or if you've had a hysterectomy where they've taken your ovaries out, calcium and vitamin D for sure. There are some instances they will give you hormone replacement therapy for those that, you shouldn't be going through menopause until about 50, 55, technically. So if you're a candidate for hormone replacement therapy before that, that would be a good thing to do. But there are some women that aren't, depending on the reason for their hysterectomy, whether it's cancer or not, and if they have estrogen receptor positive cancer. So if they do, they can't take estrogen. So basically, them staying active, exercising, calcium, vitamin D, abstain from smoking. If you are smoking, please stop. If you're drinking alcohol, please stop, things of that nature. And making sure your weight stays optimal.
One thing you also mentioned is people who are going through cancer treatments. Are you meaning radiation, chemotherapy, both?
Mainly, it can be with both for sure. And usually, the oncologists are very good at screening and taking care of these patients, and starting some medication, because the medications that they're on for their treatment of cancer will demineralize the bone and make them more susceptible to break.
So you talked about the bone density test that you guys do. It's called the
DEXA scan, or bone density.
Well, I was close. I was so close to that. And you mentioned that obviously that starts at least at 65. They start doing that is that one of those things that you would need to ask your primary care physician about, or is it something that they say, hey?
Well, for the most part, it should be considered in a yearly routine visit with your provider. It's definitely covered and discussed in what we call the Medicare annual visits that we have for patients that are on Medicare. So every year, Medicare will pay for a patient to have these visits. And during that visit, all we discuss are screening tests that you should be that you qualify for. Okay. But definitely, if you feel like you're at risk, definitely discuss with your provider, especially if you've been on chronic steroids for COPD or asthma, or for like a autoimmune disorder, because they use steroids a lot for rheumatoid arthritis. Those people are at higher risk.
I wonder about those steroid treatments. Obviously, those are necessary at certain times, but it attacks, obviously, the bones in certain ways, and you're getting healthy in one way. You're trying to help yourself in one way, but it has the side effects that you have
Sometimes
to watch for.
it's an evil necessity to have it, for those patients that do need it, but you definitely have to be careful because it can cause long-term problems in other areas.
So we talk about people who may have osteoporosis. Osteoporosis. I'll get it eventually. I think the itis, the otis, I'll figure them out at some point. There are still people who want to be active in the gym. And one of the ways, as you mentioned, to help, number one, try to mitigate or hold off on that is weight-bearing exercise. What types of weight-bearing exercises? And number two, why are they so beneficial when it comes to the bones?
So even weight-bearing exercises, we're just talking simply walking. Simply walking, it will help. Doing your cardiovascular exercises where you do like aerobics or something like that. You're definitely doing a lot of stepping with that, step aerobics, because every time you take a step, you're stimulating the bone to make more bone growth. So that's why it's important.
So you want to start that obviously as soon as possible.
Yes.
You want to start that if you can. Probably at the middle school to the high school level, and then continue with that. And again, if we had a magic wand, obviously we would wave it over everybody, and everybody would stay healthy and stay at that positive weight. And but that doesn't happen. Obviously, there are people who are trying to come back from that, and I would assume that for you guys, the best way to tell your patients is, okay, here's where you are. But it's never too late to start this. Get it started. Get it started. Try to lose this weight. Try to stop the smoking. Try to stop the drinking.
Yes.
Try to get more vitamin D. Try to get more calcium. Start moving. That's why I think this Prescription for Your Health program is so not only important, but very, very positive to have here. We know the numbers in Roane County, specifically West Virginia in general. But this program can come through you all. This can come through the primary care physician. It can come through all these tests, and they can actually prescribe the program, correct?
Yes. Yeah, absolutely. Any provider at Roane General, primary care-wise, can refer their patient to Prescription for Your Health, and they can have access to our gym and all of our resources here. It's very important that we start doing this because, it was, according to Bone and Health, the Osteoporosis Foundation, 8.9 million osteoporotic fractures happen annually, with one osteoporotic fracture every 3 seconds.
My goodness.
1 in 3 women over the age of 50 will sustain a fracture. 1 in 5 men over the age of 50 will sustain a fracture.
When I think about that, you and I spoke right before we started here on the podcast. I feel like, and maybe it's just me, maybe it's just because I'm who I am, but of a lot of things that are talked about when it comes to aging and medical issues, although osteoporosis is talked about, it doesn't seem like one of those that's really focused on as much. Maybe I'm just missing that.
It's not really focused on a lot because we're lagging in the education and the appropriate screening. Screening for osteoporosis should really technically probably start before the age of 65, and they're working on trying to get the age requirement lowered.
Yeah.
Unfortunately, a lot of insurances will not pay for it before the age of 65 unless there has been a fragility fracture or a compression fracture.
And that's interesting to me because, as you talked about, women are more likely to have that issue start during, right after menopause.
Yes.
It's like, well, okay, as you said, the numbers don't add up to 65 there.
Right.
Those are way earlier numbers, so that's something. And again, I'll not be on my high horse about this.
Well, it's just like screening tests are like they're reevaluating when you should be screened for certain things. They've lowered the age on several screening tests in the last 10 years. Before it was 55 for colonoscopy, 55 for colonoscopy. Now it's 45.
Yeah.
So they're definitely looking at the age and trying to get that reevaluated so the insurance is more readily available to pay for it.
It's just like molasses. slow moving, right?
Yes, absolutely.
So we've talked about obviously some of the tests that need to be done for that. And we talked about why weight bearing exercises are important. And again, weight bearing, as you mentioned, just something as simple as walking and
Yes.
moving to try to continue to grow your bones until you're 30 and then try to. What were those cells you talked about?
There's osteoclast and osteoblast. Blast make the cells, class chew them up.
Okay. See, that's why you're here. That's because I don't know the difference between the two. You mentioned, again, nutrition. And I hate to harp on all these things, but they are basic when you talk about them, but they're not so basic for people who live. And we see a lot of that just specifically in the program. We see people who are vastly overweight, who have been sedentary. We see people who don't have good diet habits. We see people who have comorbidities. We see people who are smokers. There's a lot of things for people that need to get some information. And that's where you guys come in. And again, that's where this program comes in. Why nutrition? Why is it so important? We know it's important, but why is it so important when it comes to osteoporosis, when it comes to those things? Obviously, you said you can take supplements. You can take vitamin D and calcium supplements, but it's also a little more important to get it naturally through the actual diet itself.
Yeah, it is. Unfortunately, in West Virginia, some people just don't have the availability, whether it's due to the cost, the location, proximity of stores, and getting the resources. There's several counties that don't even have a grocery store in their county. So, it's really tough. So unless they are like producing the stuff off their farm, it's hard for them to have these things available to them. So, it is very important that, we do our very best to make sure that we are giving every resource to these people that they need. That's why we also have, there's some places that do the pharmacy program that give them food, teach them healthy habits with eating, make sure they're getting the right minerals and vitamins.
Okay. Now, we have those capabilities here, which is kind of nice. We have a nutritionist
Yes.
In Vicki Withers. We have it's kind of a health coach. Kim Mertz is kind of a chameleon. She does a lot of things. But we also there is a food class that takes place here at the fitness center in their special room. I don't know how in-depth that food class is, but I know it's a class designed to try to give some healthier options and explain some things to people who may just not know. They may just not know what the proper diet and exercise truly is. That's why the people are here to do that. So when people come to see you and they are diagnosed, let's say, what are some of the questions that they have for you guys? What are some of the, obviously, as you said, do this, but what are some of the questions that you may not be expecting from people when they find out they may have osteoporosis?
So some people are concerned, well, how long will I have to be in treatment? So treatment is pretty much lifelong, but unfortunately some of our medications have a time limit. So certain medications you can only be on for a certain period of time and you have to switch to something else. And then our best option for medication is Prolia, which is an injection that you get every 6 months, but it's only approved for 10 years. So they're still lagging in how long, can we go further with this medication? Can they or do we have to take a break from the medication and then restart medications at a later date? But unfortunately, during that break of the medication, their bone starts to demineralize again. So therefore, they are at risk for fracture.
And so what are your suggestions to people who have it maybe and are wanting to do their best to stay active? Are there risks assessed, or risk factors with that? And you tell them maybe you don't want to do this type of exercise versus this?
So basically, we tell people just general walking, just something safe. We also want to make sure that their house is safe. A lot of people, especially the elderly, they love to have area rugs in their home. So we don't. So we discourage any area rugs in the living room, kitchen. But we do encourage that you have a rug in your bathroom that has the anti-slip stuff on the back of it. So when you step out of your bathtub or your shower, that you don't go sliding or tripping. We also recommend that you have bars or you have the anti-slip stuff in your shower so you don't trip and fall. We recommend that the hallways in your house be well lit at night, or you have a flashlight beside your bed when you go to the bathroom. We also encourage that you have your pathways through your house cleared. It's very easy. We don't always pick up our feet when we walk. We sometimes shuffle, especially when we're tired, or if we have hip pain, knee pain. We don't always lift our legs and our feet the way we're supposed to.
Yeah.
Okay, so therefore, you want to decrease the chance of you getting your foot snagged on something and tripping and falling. Same way with cords. If you have like extension cords or cords to your recliner, a lot of people have those. Electric recliners, but you got to be careful with the cords and make sure the cords aren't sticking out where you're going to get your feet caught in them. If you're going to have blankets, throw blankets in the house, make sure that when you get up, you make sure they're completely on the couch or in the chair and not halfway hanging off, because you can trip and fall in those. So we try to encourage a safe environment for everybody. Walking, like I said, just simply walking, like if you're at your house and you're trapped in your house and you're like, you can't get out because of the weather or you're at risk for a fall, if you're watching TV, when the commercial comes on, get up, stand in place and walk for that time of the commercial. That's better than nothing. Or make a couple trips to your house, because, obviously some people are not able to get out of their house because they are closed, they're house ridden, but they're enclosed because of other reasons.
So a lot of very good preventative techniques there that I heard in that, and things that obviously I wouldn't normally think about, but if somebody's got it, those are things that they may not even think of. So obviously things that you guys can help them with when they come to you guys with that diagnosis and how they're going to fix it. One thing you mentioned to me, and I as someone who doesn't really, I know that osteoporosis is a bone thing. And you laid it out so perfectly for me before we came on here. And I meant to ask you when we asked about what is osteoporosis. And you said, basically think of it as two types of bread. And I thought this was so good that I had to get you to say it on air. So good bones versus bones with osteoporosis. There's two different types of bread, correct?
Correct. So you're basically, when you think of bread, you're looking at a very heavy, dense bread, like sunbeam bread or like a potato bread. Like it's very heavy. It keeps its shape, keeps its form. You can't see through it.
Yeah.
But when they tell you that you need to cut back on your calories and your carbs, you go to the Heiner's 35, and it's very thin. It's very open. You could kind of read through it, and it just doesn't hold its shape. You hold it up, and it just goes bloop. Yeah. Just falls over. So that's the difference between the sunbeam brand, the potato bread is the good bones before osteoporosis, and Heiner's 35 bread is your osteoporotic bone.
And you brought us an actual diagram of this.
Yeah.
And it's just, as you said, it's just density. So you look at a healthy one, it's very closed in, very dense. And then you look at the other one, the bone mass itself is just not there. That's very interesting that it's as simple as that, but so not debilitating, but so dangerous once you have it.
Well, it can be debilitating. You know, problems after a fracture is the decline from your prior level of function. You may not be able to perform one of your day-to-day living activities that you used to be able to do before. Some people get depressed because they can't do what they used to do before. Some people have chronic pain from where they fractured, whether that's hip pain, leg pain, thigh pain, arm pain, whatever. They have a disability, Some people are not able to walk without a walker, without a cane.
Yeah.
Some people are even actually, sadly ridden to a wheelchair because they can't move. There's an increased risk of subsequent fractures. You're 2 to 3, they said it's 3 to 5 times more if you fracture once from osteoporosis, you're 3 to 5 times more likely to fracture again. Yeah. Right. Some statistics, consequences of a hip fracture, which we think about that in our elderly patients. Yeah. 80% are unable to perform at least one ADL, which is your day-to-day living activities. 40% are unable to walk independently ever again. So whether that's with a walker, a cane, or someone helping them.
Yeah.
30% are permanently disabled, and 24% will die due to the hip fracture.
And that's just the hip fracture.
Yeah.
These fracture falls are so, we said, debilitating for people of older ages. I remember talking on a podcast we did with Veronica Stover. She teaches a class about balance, and she's talking about all ages, but she says specifically for people who are older and people who need to keep good balance because they want to avoid those falls. You add osteoporosis to it, and it just becomes that much more dangerous. So the goal is to stave it off as long as possible. Do the weight-bearing exercises, get your health right, obviously. Exercise, get your nutrition right. If you're a smoker, stop. If you're a drinker, stop. And really hone in on it. And then if it comes on, obviously go see your primary care physician. You find out you got it. There are medications, as you said, that you can take for a while, but you can still do some things that can try to make it or limit the problems with it. And then, as you said, when you get to the age where you need to be very, very wary about falls, the preventative measures that you can take just around your house, get things cleaned up, make sure it's a safer place to be. All those things go into trying to manage osteoporosis, as it were. Laura, thank you for waiting on us, number one. People out there don't know this, but thank you for being very patient with us. And thank you so much for offering this wonderful information on osteoporosis, which is something, as we said, we should probably talk a little more about, and people should talk a little bit more about and take very seriously because, as you said, it can be debilitating. It can be very, very difficult for people who, once they have it, to manage. So thank you, and hopefully you have a wonderful day with your patients.
Thank you. You have a great day.
Another wonderful episode. Thank you all so much for tuning in, and thanks to Laura Smith for the great information.